Hello, I'm David Hart, Executive Vice President at the Florida Chamber of Commerce. Welcome to another edition of the Florida Chamber's Bottom Line. Today we're going to be discussing healthcare issues with the Secretary for Florida's Agency for Healthcare Administration, Secretary Liz Dudek. Secretary, welcome to the show.
Hey, good morning, David.
Good morning. One of the big issues that you've been working on at AHCA for the last few years is the transition to managed care in the Medicaid program. And when the governor and the department won approval from the federal government last year, you've now had the opportunity to really sink your teeth in and start the transition. Curious how that's going and what you see as the big opportunity.
Okay, I'm glad you asked. Actually, folks have been saying, when are you going to start? And the fact is, we're almost finished. We've already rolled out all of long-term care. That completed in March. And beginning in May, we began rolling out the remainder of the Managed Medical Assistance Program. We've got over 1.3 million individuals enrolled, and by August 1st, we will have rolled out the entire program. So we're really, really excited about it, and excited about the fact that we've got individuals who will not only get the services they had before, but enhanced services that weren't ever available to the Medicaid population.
Right, and so the goal was to achieve quality care and at the same time cost savings. So tell us how you see that playing out over the next few years. What type of savings do you think the taxpayers and the state government will be seeing?
Okay. Sure. As you know, we had a very large procurement, I think the largest procurement in the state. We had very tough negotiators who met with the plans and talked to them about the quality, the cost, and how could we get not only the services that were available before to that population, but enhanced benefits. And we did that, making sure that it was actuarially sound, because sometimes people will talk about something and can't provide it later on. And we are not only going to realize savings of over 5% on what we traditionally paid for this population, but we're going to get additional benefits. So enhanced dental for adults who never had dental services, enhanced vision, enhanced hearing services, enhanced outpatient services. So people will get services that Medicaid never paid for before through this program.
All that and with reduced cost. That's very good. Do you think in a few years from now we'll see Florida as such a model that other states will be calling you and asking, how did you do this and how would our state follow Florida's path?
I think they're already calling us, and we're excited. Our Medicaid director, Justin Sr., has been out and about talking to different states and other Medicaid directors about how we've done it. We're clearly a leader in this regard, because not only have we been able to maintain a program, start a new program in terms of the transition, but we have made sure, because of our outreach efforts, that the Medicaid population, other than having to pick a plan, never misses a service, never misses getting their medications filled. We've worked with the pharmacies to do that, so that every pharmacy that serves Medicaid recipients can fill a Medicaid recipient's medication requirements, even though the recipient might not know which plan they're in. The pharmacies know which plan they're in. So we've done lots of outreach, which I think is a model for other states on how you reach the number of people that we've reached through webinars, hands-on actual outreach. I've gone to facilities and talked about what we're doing, and even this past week was in the Panhandle and heard about some problems. We've got folks going out there this week to talk to them about how is it going to work and smoothly for everybody. So it's exciting.
Excellent. Secretary, you're familiar with the Florida Chamber's 6 pillars, and one of those pillars is governance, and we talk a lot about the importance of being efficient. We talk a lot about cost savings and lack of or reducing duplication, but we also talk about reducing fraud, and I know Medicaid fraud is unfortunately a significant issue in Florida, but it's also one that your agency works on to try to reduce. Can you speak to that?
Sure, I'd be glad to. As you know, we work very closely with the Attorney General's office in terms of following up on any purported fraud. But one of the most important things that we want to do is to avoid any type of possibility for fraud in the beginning. So we have very strict requirements with the plans in their contracts in terms of what they have to report to us, how they have to work to us, the prior authorization that has to go into place. So we believe with some of those efforts, as well as the ability to, and the legislature was kind enough to give us some funding for things like data analytics and other detection tools that we haven't had in the past, to be able to not only try to avoid it to begin with, but should it occur, which, you know, any dollar that is misspent is a dollar misspent and not a good thing, to make sure that we can, if you will, follow the perps and get on them right away and stop it before it happens again.
Very good. Secretary, we want to thank you for the 38 years of experience in healthcare you bring to the table and to your service at ACA and to the people of Florida. And to our viewers, thank you very much for joining us on another edition of the Florida Chamber's Bottom Line.